So how often should you get a screening mammogram is a very good question, and that's going to vary depending on who your referring provider is and what guideline they follow. I'll tell you the guideline that we recommend at the Baptist Breast Centers is we follow the guidelines of the American College of Radiology, the Society of Breast Imaging, and the National Comprehensive Cancer Network, which are three very solid institutions. And our guideline is basically that women of average risk for breast cancer should begin getting their annual screening mammogram at age 40 and continue getting that mammogram once a year as long as they live. No upper limit, as long as they're healthy. You know, if you're 90 years old and you're in a nursing home and you have a lot of other medical problems, there's probably not a need to get that screening mammogram. But if you're 90 years old and you're vigorous and you're out jogging, every day, then keep getting your screening mammograms, because that may save your life. Because a lot of women think that the breast cancer is less likely to occur as you get older. That's not the truth. Breast cancer continues to be a risk into your old age, and actually increases in frequency the older you get. The breast cancers tend to be less aggressive the older you get, okay, but they still occur. So I want to make sure that's understood. The risk of breast cancer never goes away, and therefore we follow those guidelines. Now there are other guidelines out there. Some guidelines that recommend every 2 years starting at 45, or every 2 years starting at 50. Those are reasonable guidelines. We don't adopt those guidelines ourselves, but what's important is what your discussion with your physician and what your physician feels is appropriate for you. And we'll be glad to see you here on whatever frequency your physician thinks is the appropriate frequency for you.